Good morning, class. So today we'll be moving on to the next meridian, the stomach meridian. So the full name of this meridian is the stomach meridian of the foot yangming. So once again, just from the name, we can get a lot of details on where the meridian flows and in what direction it flows. So firstly, we know it's the stomach meridian, so its associated organ is the stomach. Then secondly, it's a foot yang meridian, and all the yang meridians of the foot run from the head down to the toes. So we know it's going to originate in the head and it's going to go all the way down to the leg. And then because it's the yangming meridian, this means it's the most yang of all three meridians, and therefore will be the most anterior of the three meridians. So it's going to be on the anterior and lateral portion of the leg. This meridian has 45 points in total, and the common indications between points are for diseases related to the stomach, such as the upper abdominal pain or indigestion, and then it can also be used for other diseases related to the distribution location of this meridian. In other words, it can be used for any diseases along the flow of this meridian. So now let's look at the course of this meridian in a bit more detail. So firstly, this meridian originates at the side of the nose, around here, and what it does is it ascends to the inner canthus at the bridge of the nose where it meets the bladder meridian. And the inner canthus is shown in this image over here. So if you see this portion here is the inner canthus. So it ascends up like this to this region. And then from there, it then descends lateral to the nose and enters the upper gum. So it descends like this. And over here is the first point of this meridian. So what will happen is that these first 2 points, point 1 and 2, you'll see on the image up here is actually dotted lines because it's not the part of the main meridian. And stomach 1 only actually starts just below the eye over here. And then from stomach 1, it continues descending and then it enters the upper gum, as you can see over here. It then circles around the lips and descends to the angle of the mandible. So the angle of the mandible is shown in the next image over here. So the angle of the mandible is this red portion over here. So it's where the angle changes from a more vertical line to a more horizontal line like this. And that's what we refer to when we talk about the angle of the mandible. So our stomach meridian was running like this all the way down, went like this, and then down here, and then it came all the way to the angle over here. And then from the angle of the mandible, it branches. One branch ascends and one branch descends. The ascending branch continues ascending anterior to the ear and ascends all the way up along the anterior hairline to the forehead. So that's this portion here. And then all the way up the anterior hairline, and then it moves more medially to the forehead. And then what the descending branch does is it descends along the neck over here and goes through the supraclavicular fossa, which is this portion here. Remember, we talked about it previously. And then it branches again just lateral to the supraclavicular fossa, where one branch moves more interiorly and is shown in the blue dotted line on this image, and the other branch remains on the exterior and is the red line. The main branch continues down the anterior torso, passing the nipple over here. And then from the nipple, it moves more medially and then continues descending along the upper abdomen, past the umbilicus, down the lower abdomen to the groin region. In the inguinal region, the other branch, the more internal branch, connects back to the main branch, and they both continue moving laterally to the anterior portion of the leg. And then they run down the anterior portion of the leg like this, where they pass just lateral to the patella over here. And they continue descending along the lateral and anterior aspect of the tibia over here. And then they continue descending all the way to the foot, where they run along the dorsal aspect of the foot. And they terminate on the lateral tip of the second toe, right about here. The major branches of this meridian. So there are quite a few branches. Firstly, the branch at the angle of the mandible. So this is the one we mentioned earlier where there was ascending and descending portion, which is over here. The second branch is the forehead branch, and this is referring to the branch which occurs at stomach 8, which is about here. And what it does is it branches off from the main meridian. That's why there's a dotted line here, and it moves along the anterior hairline to the forehead, like this. And then the third branch is the supraclavicular branch, which occurs over here. We also mentioned this earlier, and this is the interior portion, which is shown with a blue dotted line. And here it enters interiorly and connects to the stomach over here, and the spleen, the associated organ to this meridian. And then it continues descending from the upper abdomen to the lower abdomen, where it connects back to the main meridian in the inguinal region, which is this region here. And then the fourth branch we've called the tibial branch, and this occurs at stomach 36, which is this point over here. What it does is it branches off of the main meridian and then descends the anterior aspect of the leg and terminates on the lateral side of the middle toe over here. Whereas this is different to the main meridian, which is on the lateral side of the second toe. And then the final branch I've called the dorsal foot branch, and this branch arises at stomach 42, which is over here. It diverges from the main meridian and then travels along the medial aspect of the big toe to connect with the spine meridian at the medial part of the big toe. So in this slide, I want to go through the general flow of the meridian on the torso, as what happens is certain parts of the meridians follow a specific pattern. And if you know this pattern, what you can do is you can easily remember where points are located. And this is especially useful on the torso region, as points on the torso region all follow very similar pathways. And if you know the different meridians pathways, you can remember many points by only knowing one or two details. So when we locate the points on the chest and abdomen for the stomach meridian, the first thing we locate is the anterior midline. And this is this red line here in the middle. Then we're going to locate the midpoint of the clavicle. So what you're going to do is you're going to go here to the medial end of the clavicle, and then you're going to palpate here and locate the lateral end of the clavicle, and you're going to take this distance from the medial to the lateral ends of the clavicle and divide it in half. And this is the midpoint of the clavicle. And then this measurement is 4 tsun. So what this means is that the clavicle is 8 tsun, so midway is going to be 4 tsun. And one thing to note here is that from the midline to the nipple is also around about 4 tsun. Because if you remember from our locating acupuncture points lectures, from one nipple to the other nipple is 8 tsun. So therefore half this distance would be 4 tsun. But the reason why we don't use the nipples is firstly that they can vary in their location in different individuals, and in females they will not be accurate to use as the breasts are different sizes and therefore the nipple might be in different locations. So a much more accurate measure is to use the clavicle rather than the nipple. And then next we're going to go back to the midline. So what we're going to do is we're going to get the distance from the umbilicus to the sternocostal angle. And do you remember from your locating acupuncture lectures what this distance is? So this distance is 8 tsun, and then we're going to divide this distance in half to get 4 tsun, and a half again to get 2 tsun. And then if we add the 4 tsun over here plus the 2 tsun here, that makes this distance 6 tsun. As this was 4, that's 6, and then that would be 8. And then once we have these measurements, what we do is we draw a line down from the midclavicular line, straight down, all the way to just below the nipple in the 5th intercostal space. And then what will happen here is that the meridian will move more medially from 4 tsun lateral to the midline to 2 tsun lateral to the midline. And then it will once again run from 2 tsun lateral to the midline, here at the 6 tsun above the umbilicus mark, and it will continue 2 tsun lateral to the midline all the way down to the lower abdomen. And why it is useful to know this is that the points from stomach 12 to stomach 18, so that's these 6 points, will all lie 4 tsun lateral to the midline. So you'll know this measurement here is constant for all of these points. You just have to then remember where along the meridian they are. And then from stomach 19 to stomach 30, which is another 12 points, these points all lie 2 tsün lateral to the midline. So you already know that measurement. You'll just have to learn the longitudinal measurement. So where along this part they lie. And then this slide shows the frequently used points. So there are quite a few frequently used points on the stomach meridian. These are stomach 1, Cheng Chi, stomach 2, Si Bai, stomach 4, Di Kang, stomach 6, Jia Che, stomach 7, Xia Guan, stomach 8, Tao Wei, stomach 25, Tian Shu, stomach 31, Bi Guan, stomach 32, Fu Tu, stomach 34, Lian Qiu, stomach 36, Zusan Li, stomach 37, Shang Ju Shu, stomach 38, Tiao Kou, stomach 40, Feng Long, stomach 41, Jiu Shi, and stomach 44, Nei Ting. So now we're going to move on to the individual acupuncture points. So the first point is Cheng Chi, stomach 1. So this point is located with the eyes looking straight ahead. So as you see in this image, they're looking directly at us. And then we're going to go directly inferior to the pupil, like this. And then we've got to be between the eyeball and the infraorbital ridge. So if you see over here, this part of the image quite nicely illustrates these two things. The eyeball, which is this part over here, and then the infraorbital ridge, which is this ridge here, running all the way around and just outside of the eyeball. And what we've got to do is we've got to be between these 2 points. And then stomach 2 can be used for conditions affecting the eye, such as twitching of the eyelids, tears due to wind irritation, night blindness, or myopia. It can also be used for disorders of the eye and mouth, such as deviation of the eye and mouth, facial paralysis, and facial spasms. And then this one has a very unique needling method. When we needle this point, what we have to do is we have to take our palpating hand, and then we use the palpating hand to push the eyeball. So we take our thumb or index finger of our palpating hand and we press it over here. And what we do is we push the eyeball upwards in this direction to increase this infraorbital space over here. And then while the eyeball is held up, we're going to insert perpendicularly below the eye 0.5 to 1.5 tsün along the infraorbital ridge. So that's this ridge here at the bottom. And then the caution when you are needling this point, it is not advised to use lifting and thrusting method of manipulation, as this is more likely to injure the underlying blood vessels. And if you look here, these 2 images show you the blood vessels which lie around the eyeball. So if you look at the top image first, the needle will be inserted like this. So as you can see, there are blood vessels in the vicinity, and the more we lift and thrust, the more likely we are to puncture one of these blood vessels. And then secondly, we also advise to apply pressure on this point after you remove the needles to reduce the risk of excessive bleeding and bruising in the area. The next point is Si Bai, stomach 2. So this point is also located directly below the pupil. So once again, you're going to ask the patient to look straight ahead. And then we're going to go directly below the pupil, past stomach 1, and stomach 2 is in the depression of the infraorbital foramen. So if you see the right portion of this image over here, once again, the infraorbital foramen is a hole just below the infraorbital ridge over here. And this hole can be palpated when palpating in this region. So what you would do is you'd first locate the infraorbital foramen by palpation, and then you could needle into this point. And then stomach 2's indications, it can be used for redness with swelling and pain of the eyes, twitching of the eyelids, and glaucoma. It can also be used for deviation of the eye and mouth, facial spasms, trigeminal neuralgia, and other facial diseases. And then finally, it can be used for headache and dizziness. Our insertion is a perpendicular insertion, 0.3 to 0.5 tsün. And deep insertions and excessive manipulations are not advised for this point. And the reason is because there are nerves that run through this infraorbital foramen. So if you did a deep insertion, you're more likely to hit one of the nerves, causing unnecessary pain for the patient. And this is also true if you did excessive manipulation. You're also more likely to damage or aggravate the nerves in this area. And then when we're treating conditions such as trigeminal neuralgia, we can also use a horizontal insertion for this point. And what we'll do is then we can needle from stomach 2 to another point. For instance, we can go like this and needle stomach 2 in this direction all the way down to stomach 4. And then we can use a much longer needle, such as a 2-tsun needle. And then we'll do the horizontal insertion all the way down to stomach 4. Or we could use it to stomach 6, which would be in this direction. And both stomach 4 and stomach 6 you'll learn about in the next couple of slides. The next point is Juliao, stomach 3. So this point is located directly inferior to the pupil. So just like the previous two, ask the patient to look straight ahead, and then you're going to draw a line directly below the pupil, all the way down the cheek, and then we're going to draw another line from the lower border of the ala nasi. So if you remember from previous slides, the ala nasi is the nostril, this part over here. So we've got to go to its lower border, and then we've got to draw another line like this. And then the point where these two lines connect is stomach 3. And this will normally be just lateral to the nasolabial groove, which is this groove over here. Stomach 3 can be used for deviation of the eye and mouth, epistaxis, toothache, swelling of the lips and cheek, and any other disorders of the 5 sense organs. Our insertion is perpendicular, 0.3 to 0.5 tsun. Our next point is Dikang, stomach 4. This point is also once again located directly below the pupil with the eyes looking straight ahead. But this time we're going to go all the way down until we are 0.4 tsun lateral to the corner of the mouth. So here's the corner of the mouth, and we've got to go 0.4 tsun lateral to this. And the indications for this point are for conditions such as facial paralysis, trigeminal neuralgia, excessive salivation, and other diseases of the local area. And like we just talked about from stomach 2, we could needle from stomach 2 up here all the way down to stomach 4 in conditions such as trigeminal neuralgia, as both points are very effective, and then we can get the action on 2 points with one needle. If you look at the insertions here, it's an oblique or transverse insertion, 0.5 tsun. Otherwise, we can use a horizontal insertion with the through needling technique, just like I mentioned. So we can through needle in this direction to stomach 6, or we could also needle upwards towards either large intestine 20, which is over here, or to stomach 2. And then can you think why we do not do a perpendicular insertion for this point? So if you think about where this point is located, it's located on the cheek, and there's not much tissue in this area. So if you did a perpendicular insertion of 0.5 to 1 tsun, you would end up going straight through the cheek and coming into the mouth region. So this is why we do not do perpendicular insertions on this specific point, because of what lies beneath the point, which is the cavity of the mouth. The next point is Daying, stomach 5. So this point lies anterior to the angle of the mandible. And we talked about what the angle of the mandible was in the previous slides. So that's this here, this angle here. And then we're going in the depression on the anterior border of the masseter muscle. So in this image, they've clearly shown the masseter muscle over here. And we've got to be on its anterior border as well as being anterior to the angle of the mandible, which would put it in this region. And then what you must also note is that it's very near the facial artery's pulse. So when you're palpating this region, you'll feel around this region there will be the facial artery, and you can easily palpate the facial artery's pulsations. Once you have located this point is very near to this pulsation. The indications for this point, it can be used for deviation of the mouth and eye, swelling of the cheek and toothache. It can also be used for other diseases of the local area. Our insertion is oblique, 0.3 to 0.5 tsun, or we can also use the horizontal insertion with the through needling technique, just as stomach 4, where we needle towards other points such as stomach 4, so that would be in this direction, or to stomach 6 in this direction. And the caution for this point is that it's contraindicated to do vigorous manipulations, as these carry the risk of damaging the facial artery and vein, which are very close to this point. The next point is Jia, stomach 6. This point is located on the prominence of the masseter muscle, so that's the highest point of the masseter muscle, approximately 1 tsun anterior and superior to the angle of the mandible. So once again, this image here shows you the angle of the mandible, which is this portion here. And then we've got to go 1 sun superior, so that's up from the angle, and 1 sun anterior, which will be in this direction. And then this point should correlate to the highest point of this masseter muscle, which would be around this region. This point is indicated for temporomandibular joint disorder, also known as TMJ syndrome. Also, it can be used for swelling of the cheek, deviation of the eye and mouth, and toothache. It can also be used for diseases of the local area. Our insertion is perpendicular, 0.3 to 0.5 sun, or we can do the horizontal insertion similar to the previous points, where we threw needle to points such as stomach 4, which is in this direction, or small intestine 18, which is in this direction. So the next point is Shiaguan, stomach 7. So this point is located on the lower border of the zygomatic arch. And if you look at the image on the right, here's the zygomatic arch over here. So we've got to first palpate for the zygomatic arch, and then we've got to go to its lower border, which is around here. And then next, we've got to look for the depression 1 sun anterior to the condyloid process of the mandible. So if we look here at this little circle here, on the bottom left of the image, this is the condyloid process, this bone here. So that's the condyloid process of the mandible. And we've got to be 1 sun anterior to the condyloid process. So you'll palpate here and find the condyloid process. And then you're going to go 1 sun anterior to it. And what this bottom image in the circle is showing is that when the patient opens their mouth, the condyloid process will slide into this gap where stomach 7 is located. So you must just be aware of this, as you won't be able to locate the depression if the patient's mouth is open. And then the final point for the location is it's anterior to the tragus. So if you look at this image I've just brought in, this is illustrating what the tragus is. So if you can see here in red, this over here is pointing to the tragus. And the tragus is the piece of flesh in front of the ear canal over here. So we've got to go anterior, which will mean in this direction from the tragus. And then stomach 7 can be used for TMJ syndrome, trigeminal neuralgia, deviation of the eye and mouth, toothache, and other diseases of the face and mouth. It can also be used for deafness, tinnitus, otorrhea, and otitis media. Our insertion is perpendicular, 0.5 to 1 sun. And one caution to note here is that because the condyloid process moves forward into this depression, it is not advised for the patient to open their mouth or to talk excessively when we have needled this point, as this could cause the condyloid process to bend the needle. The next point we'll be looking at is Toway, stomach 8. So this point is located at the corner of the head, half a sun directly superior to the anterior hairline. So if we look at the image on the right, this image over here, the anterior hairline refers to this portion of the hairline. So what we've got to do is we've got to go half a sun into the hairline, because they're saying superior, so that's in this direction. And then we've also got to be 4.5 sun lateral to the midline of the head, where 224, also known as shenting, is half a sun into the hairline at the midline. So we'd be 4.5 sun directly lateral to do 24. And that would put us in this region over here. So this point can be used for headache, vertigo, aching of the eyes, and other diseases of the head and eyes. Our insertion is a horizontal insertion, 0.5 to 1 sun. And with this point, like many other points on the scalp, we change the angle of insertion to direct it towards the area we wish to treat. For instance, if we were treating aching of the eyes, our needle direction would be aimed towards the eyes in this direction. But if, for instance, if we were treating a parietal headache, which would mean the headache is in this region, our insertion could be more in this direction. Our next point is Renying, stomach 9. So this point is level with and 1.5 sun lateral to the tip of the laryngeal prominence. So that's this region over here. And remember, the laryngeal prominence is another name for the Adam's apple. And what we're going to do is we're going to locate the Adam's apple, also known as the laryngeal prominence, and then we're going to go 1.5 sun lateral to it. And this places the point in a depression between the sternocleidomastoid, this muscle over here, and the lateral border of the thyroid cartilage. Here's the lateral border of the thyroid cartilage, and we've got to be between these two structures. This point can be used for scrofula, goiter, sore throats, hypertension, and tachypnea. Our insertion is a perpendicular insertion, 0.3 to 0.5 cun. And the caution here is we've got to be very cautious when using this point and ensure that we are needling to the appropriate depth, but also that we are not anywhere near the carotid artery, which must be first palpated and then held laterally when we needle this point. And if we look at the image again, the image shows the carotid artery right over here. So as you can see, it lies very close to where this point is. So what we have to do is palpate for the carotid artery, and then we're going to use our finger to grasp the carotid artery like this and pull it towards this direction to ensure that we do not needle it. And if we look at this image here that I've just brought in on the right, this just shows you the carotid artery without the sternocleidomastoid muscle, which blocks a large portion of it, so we can't exactly see where it flows. So if we think about where this point is, here's the laryngeal prominence. The sternocleidomastoid would run around here. So midway between these 2 points, we'd be needling around this region, which is very close to where the carotid artery runs. The next point is shui 2, stomach 10. So this point is also on the neck, and it's on the anterior border of the sternocleidomastoid. So here's the sternocleidomastoid, as we've talked about many times before, and we're going to look for its anterior border over here. And then where along the anterior border, it's got to be at the midpoint of a line joining ren ying, which was stomach 9 over here, and qi shi, stomach 11, which we'll do next over here. So we've got to take these two, draw a line, find the midpoints, and then we're just going to move anterior until we're at the anterior border of the sternocleidomastoid, which is over here. This point can be used for sore throats and other diseases of the local area, and for cough and tachypnea. Our insertion is perpendicular, 0.3 to 0.5 cun. The next point is qi shi, stomach 11. This point is also on the neck, at the superior border of the medial end of the clavicle. So what you can do is you locate the clavicle and you find its medial border over here. It's normally around this region. And then what you've got to do is you've got to go just superior to this. And if you are in the right location, you should be between the sternal and clavicular heads of the sternocleidomastoid. So again, here's the sternocleidomastoid. And as you can see, this is the sternal head here. And this is the cleidal head, and then you can see that it forms a gap just over here, and you should be right in that gap. This point can be used for sore throat, scrofula and goiter, tachypnea and hiccups, as well as pain and rigidity of the neck. Our insertion is also perpendicular, 0.3 to 0.5 cun. And once again, here, you've got to note that deep insertions are contraindicated, as this can puncture the underlying organs.